Most of us know someone who snores. It's really not a laughing matter, though, as there are millions of Americans who suffer from benign snoring to a much more serious health problem, that of obstructive sleep apnea, or OSA. Dr. Ronald Ghiz, a New York dentist, has been treating snoring and OSA for more than 20 years. He'll demonstrate an effective therapy to combat these disorders, reducing or eliminating the medical and social ramifications of snoring and obstructive sleep apnea once a proper diagnosis has been made.
Snoring is a partial obstruction of the airway, minimizing the amount of air getting into the lungs. Obstructive sleep apnea is a complete closure for 10 seconds or more of the airway, depriving of a good night's sleep and taxing the cardiovascular system. Some of the obvious causes of sleep apnea are overweight. 50%, as a matter of fact. As little as 5 to 10 pounds can cause apnea. And less obvious reasons are jaw structure and soft tissue anatomy. Actually, initial diagnosis is made by the nighttime partner, who in turn pushes that partner to seek professional help. At that time, a clinical exam is done with questions. And if necessary, a definitive testing is set up, which is an overnight sleep test in a lab or these days at home, called polysomnography. There are over 40 million untreated Americans with sleep apnea. They can cause anywhere from difficulty waking up, excessive daytime sleepiness, headaches, reduction in cognitive ability, anxiety, depression, and have been associated with type 2 diabetes. The more severe the obstructive sleep apnea, the more life-threatening. It induces cardiovascular issues such as high blood pressure, stroke, and heart attack. There are various treatment options available. CPAP, which is continuous positive airway pressure mask, is the gold standard. Nighttime oral appliance therapy advances the jaw forward to open the airway, and there are various surgeries. CPAP, unfortunately, has a low patient compliance for obvious reasons, as the picture shows you. But oral appliances meet the criteria in most cases and are also portable.
Thanks to all the professionals involved, my insurance, my partner, and especially Dr. Ghiz, for the appliance I now use. It has had a profound impact on my entire life. Thank you all.
Above all else, Dr. Ronald Ghiz is trained to recognize the signs and symptoms of sleep apnea, its detriment to the body, and offer a simple, convenient solution to improve your overall quality of life.